Then we have two different types of inserts, which are uterine inserts. And uterine inserts, it could be copper inserts, and copper insert, it has a failure 1 in 125, which is very high. Mirena, which is hormonal inserts, it has very less failure, 1 in 500. If you ask me in practical life what happens, I saw just 1 month back one failure with the copper was inside and baby was inside. I mean, she became pregnant just 1 month back. And it's not that it just happened 1 month back or year back. I also saw some other person, they had failure and they were pregnant with copper. With the Mirena, I never saw any pregnancy so far. Then this one is for 5 years. This one is for 5 years. If you want to ask me the side effect, and I will tell you with the 5-year, Royal College of Obs and Gynae says if you put somebody Mirena after the age of 40, you can leave it for till menopause. Isn't it amazing? Like one solution fits forever. So leave it till menopause. Yeah. This paper is going with you, so you will be reading it later also. Then side effects. When we read in our early years, when we were getting education of the gynae, we read that it can cause infection in the first week of the putting it. Trust me, I never saw it. The moment you say that doctor, put me the Mirena or the any insert, she will bring me the gloves, which will be from the same glove which I use in the operation theater. She will give me the set which will be sterilized from the theaters, from the CSSD, the same which is sterile, the theater stuff. And I never saw infection happening at all. Yeah. And it is also by literature just first week. It doesn't happen later on. And then there are cramps. Some people do get cramps, yeah. But you will take analgesics and it will be settled forever. Then in the past, when we used to put these inserts, I mean, there were no devices, there were no ultrasound machines. But today, when I put device in any woman, immediately I see it inside and I can tell you where is the location. So that side effect, which is that it can be impacted in the muscle mass or it can just fall off, doesn't happen. So I insert and I see the location immediately, and it's not just me, you will be seeing the location along with me also, right? So that side effect is also not applicable, which is insertion, impaction during insertion or fall off. Yeah, you can ask me question, don't get intimidated by that. I can put, I
So
cannot
what's the
put.
procedure for this?
It's just right there. I will be putting it under sterile condition. Within 2 minutes, it will be inside.
done.
And I will be confirming it also, same time. But insurance never covers that.
Okay.
I
How
will
much
tell you
is
the
that
price.
though?
I will also. One last side effect, which is very, very important. Copper may cause bleeding problems because it's a copper. Your body will react, detect it as a copper, and all the white cell will be there. So some people just get a lot of bleeding with that. So some
I
people
heard that
they
it's
don't.
not good also for like contacts, doc, because
No, not
it will
at
be
all.
paining for the woman. Something.
No.
No.
I just it doesn't happen. I have a lot of patients who are on the devices and they're okay. Here, 1/3 of the women may go erratic bleeding. Erratic bleeding is like the one which is not with the time, not following any discipline, and some people they won't go anything. I mean, the periods will be just normal. Pain is not there. Cramps are there in the early weeks, but they get settled also. Now, number 2 here, Mirena, 1/3 of the population will have no bleeding at all. They will not have bleeding. People take it as a side effect because they think, how would I know am I pregnant or not? So but still they know from other symptoms also. They get no bleeding. 1/3 of the people decrease normal bleeding, like they get regular bleeding but decrease in the flow. And 1/3 of the people, they get just spotting. They don't have the normal bleeding period thingy, but they just keep spot. That can also happen. Cost now.